Hey there, this is Dr. Evan Osar, developer of the Integrative Movement System and creator of the Integrative Corrective Exercise Approach. I can't believe it's already been an entire year since the release of this product. Actually, it's a 1-year anniversary. We released this product last August to really bring all the concepts that we use with our own general population clients, the assessments, the corrective exercise approach, and how we take those concepts into our functional movement patterns to help our own general population clients achieve their health and fitness goals. And we really created a resource. We wanted it to be a very complete resource. So we covered fully the core, the hip, as well as the shoulder. And we really put together the concepts from corrective exercise, how we use them, and how we integrate them into the patterns that we use most frequently with our clients to help them achieve their health and fitness goals. So it's been our best selling product over the last couple of years, I think because it's been such a complete product and answered a lot of the questions around corrective exercise and gave fitness professionals a way to use the concepts of corrective exercise and plug it right into their own programs. And one of the bonuses from the product, the program design, gives you some examples of how to use these concepts and puts them concretely into a program design so you can see exactly how to use these ideas in your own programs with your general population clients. Now, there's been some concepts that have come up over the last year or so around the idea of corrective exercise. And one of those is optimal versus less than optimal. And there's a lot of conversation that there's no such thing as optimal alignment or optimal breathing, and you can't say that there's any motor control issue that's optimal, and how do we know when it's optimal versus non-optimal? Well, I just read an article by Glenn Mills, the coach of the fastest man in the world, Usain Bolt. In fact, Usain Bolt just won several more gold medals at this year's Olympics. And one of the things he notes in the article is that when he started to work with Usain Bolt, he had to correct some of his alignment issues because his alignment issues were holding him back from performing at the highest level that he could, and also related to some of his injuries, some of these chronic injuries he had. And now we see the results of his attention to alignment and his performance. I've also been working with several golfers, both on the amateur and pro level. And one of the most common things with these athletes is not their lack of strength or their lack of power. It's their inability to control their alignment and use their breathing and motor control in a way that facilitates an efficient and consistently repetitive, optimal golf swing. So if alignment and breathing and control are so important to our elite athletes, then why is it not important to our general population clients? And the answer is, it is important. It's vitally important because our clients already have patterns that are less than optimal. It doesn't mean they can't do certain things or their inability to perform certain activities. It means they just have a less than optimal alignment or breathing or control. In other words, they have a less than optimal strategy for doing the things that they want to do. Our job, the way we use corrective exercise, is to help them develop more optimal patterns, whether it be postural patterns and, more importantly, their movement patterns. Just like a professional athlete needs more optimal activation of certain movements and patterns, our clients also need more optimal performance of alignment, breathing control, and that's how we integrate this corrective exercise approach into their programs. Another concept that comes up is the idea of strength and injuries. Now, we know that strength is important. There's no discounting the importance of strength. However, I have a lot of very strong clients. A client that squats 700 pounds and has low back pain. A client that dumbbell presses, chest presses, 80-pound dumbbells and has shoulder problems on one side and not the other. And the one thing we can see consistently with these strong individuals is they have non-optimal control of their body when they're doing these patterns. For example, the client that has trouble, he starts to get weakness through his workout and starts to lose range of motion as he's pressing these 80-pound dumbbells. And we start to see, as I worked with his trainer during his program, we saw that his scapula during the workout started to come into more downward rotation and anterior tilt. The other side, the optimal side, stayed in upward rotation and posterior tilt. The other side came down into downward rotation and anterior tilt, or that winged or forward shoulder position that we see in so many clients. So that's not an optimal pattern for him, and it's relating to loss of performance, loss of range of motion, loss of strength through his workout. So we're able to use these corrective exercise approaches to help him improve his range of motion and strength and keep it through his workout by adjusting how he did his patterns and also using some of the key corrective exercise patterns I show you in the program throughout his workout. So it's not strength that prevents injuries. What corrective exercise does is it removes the restrictions that allow someone to express fully their strength, their range of motion, their endurance. That's what corrective exercise is all about. And finally, we want to make sure that we use the appropriate progressions, because often corrective exercise will fail, or people say, oh, it doesn't work, because people are not then using the appropriate progressions. They do the corrective exercises, and then they go back to all the high-level patterns the client was using before they had their issues. So what happens is there's no progression to get them to where they want to go. In other words, there's no multi-level, do this first, and then this next, and then this next, and then put it all together in a higher level pattern. It's like, here's corrective exercise, and here's your high level pattern. There's no progression to get them there. We have a saying that we use in all our trainings, and it's basically ETR, earn the right. What corrective exercise does is it helps to remove the barriers from clients being able to express speed, strength, range of motion, endurance, balance, and helps them earn the right, and we use the appropriate progressions. We teach our clients to squat, lunge, bend, rotate, push, pull. We use corrective exercise to enable them to do it more optimally, to allow them to express their strength, and then use the appropriate progressions so that they can start to move towards their health and fitness goals. So that is what the integrative corrective exercise approach is all about. We create a complete program around the core, the hip, and the shoulder. We show the exact progressions we use with our clients. We show modifications. We show some common dysfunction you'll see in the patterns that many of our clients will do. So it's really a complete resource. And then we also create a couple bonuses that show you how to put corrective exercise into your current training programs. How do you use release? How do you use activation? How do you take the concepts from corrective exercise into all those fundamental movement patterns that you need and want to do with your clients so that they can achieve their health and fitness goals? For a limited time, for this week only, we're going to offer this product, the Integrative Corrective Exercise Approach. You'll get all the downloads of all the exercises, the modules, the educational modules that help support all the exercises that we do, the program design for a very special price. So take advantage of this 1-year anniversary sale and use corrective exercise to become that elite trainer, the elite coach, that elite specialist that your general population clients need, want, and will seek out. This is Dr. Evan Osar, creator of the Integrative Corrective Exercise Approach. Check out this resource, and we'll see you on the inside. Take care.